Okay, this is a reply to some of the comments in the regarding Ron Paul. The right to health care is based on theft and coercion. From the Ron Paul channel. Okay. Hose HD says you can have healthcare without a national healthcare system, just like you can have education without a national education system. The rest of the industrialized world might have socialized healthcare, but most of them are also on the brink of default. Ron Paul is in favor of healthcare. He was an obstetrician. Oh my God. He's in favor of healthcare existing. Okay. He believes that the free market is the fairest and most effective means by which... Well, see, the problem there is it's not working now, right? Oh, but it's not the free market, is it? So we need to free the market up more. Hey, well, the problem there is that medicine has to be regulated. You have to be highly regulated. Or do you think just everybody should have hypodermic needles and medical morphine or oh, maybe it's going to be regulated. Things is going to have to be tracked. You know, like Ron Paul was complaining, you have to do a transaction every gallon of gasoline, extra paperwork. Okay, well, it's not gasoline, it's people's lives and death. And yeah, if you're doing enough gasoline, it might blow up and kill a bunch of people. You have to do some extra paperwork. Oh, yeah, I want you to do some extra paperwork. I'm not providing an easy excuse for big government. Big government doesn't need an easy excuse or any other excuse. How are you ever going? Ron Paul believes in tort, right? In court, where you could sue people for violating your personal rights, right? That's going to be big government. Just that one job, huge government. And that's what people don't understand, just how huge the government. They don't want it to be huge. Listen, this county, I'm in a little county basically, though it is a whole island. I mean, it's got hundreds of millions of dollars in its budget. It's having a shortfall. It's still got hundreds of millions. So I might be wrong on that. Who knows? But anyway, government is huge business. Small governments are like big national businesses, you know, in the amount of budget that they take. Okay, A Lovely Time says, it's not a civil right, human or even natural right, then why the hell have any rights? Free all the murderers. So coming from the other side, A Lovely Time, well, I'm glad you do. But yeah, no, because what if there is no healthcare system? What about the Miwok Indian? Were they violating the rights of themselves? Getting health care is a group activity. It's something you do together. Not because it's a right, but because you can make your life better with its cooperation. You know, humans are cooperative animals, okay? Unhappy test tube baby. In his defense, there are a lot of people claiming health care is a right. Well, yeah, because, you know, it's equivalent. It's grammatically equivalent, what I'm saying, to calling it a right. To call it a right is not technically so accurate, I don't think. But, you know, it's something that you do for everybody gets a piece of it. Okay, aside from that, Ron Paul and many others believe private free market providers will deliver better health care. That's not happening for the reason I just said. Okay, so it is highly regulated industry now with all the technology and how dangerous it is and how much trust is involved with the procedures and which procedures and how you could kill somebody by choosing the wrong thing. You know, it's bound to be a little bit regulated. So yeah, the free market, that's in the past. This is a super important industry, and it does require some standards and standardizations. Okay, and doctors need to have, you know, they need to be subject to getting sued and have their, you know, their licenses. And just like lawyers need to have the bar, these are things that have to be regulated for them to work. Systematics, it's system design. It's not principles come into it you should use to find out, but it's basically system design. You have to be able to monitor and regulate such an important thing like this. Okay, and this person, a clipped TV. Who's going to pay for it? Are you going to pay for it? Yeah, I pay for it now. I pay too much for it. And even when I've wanted to pay for it, well, one time in my life where I was out of work for an extended period of time, I wanted to pay for it. Oh, I couldn't. It's complicated. You have to argue this or that or the other. Screw that. You know, and if I had a pre-existing condition, then fine, don't cover me for that. But no, nothing. They'll cover you for nothing. It's ridiculous. And that's the people want to say. Who, down here, later in this message, it's like, I was born and raised in Europe. The healthcare is not so good there. We're talking about people with no healthcare. Okay, bad healthcare generally, unless it's super, super bad, like, I don't even know when it's super bad. I mean, getting taken care of even by a leech doctor in the Middle Ages would possibly be better than trying to take care of yourself. The healthcare is not that. We're talking about people that don't get healthcare. I know lots of people that work professions where you just don't get healthcare. It's ridiculous. Oh, but you get emergency care because nobody wants to admit they made you die, which is ridiculous because by then it's a crisis. And And you know what it costs the system more. You want to know who's going to pay for it? Take these gross inefficiencies out. That's what it'll pay for it. Okay? All the education and tech come from the USA. Well, there's various reasons for that. We could talk about that. I think we can keep our research hospitals funded. I do not believe, for example, big pharmaceuticals are really helping all of that go along. We got a lot of crazy marketing and millions spent on things like Viagra. But, okay. Well, it's only 5 minutes. Max 64, Mac 90, I don't do the numbers. Max says, I agree with most of your premises. The free market is what really gives people access to this stuff, though. With the exception of the public highway systems, I would say the majority of government-run projects, including the subsidization of education, have been a complete disaster and have only made those areas worse. The free market can deliver the best and cheapest healthcare if government would just get out of the way. You know what? How our education is split up to the state and even then to the county because of the school boards, but especially to the state. And, you know, the fact that it's such a mess is the biggest argument for a federalized version of all of that. But I don't believe that. I believe the whole charter school and try to reinvent an entrepreneurial and individualistic spirit behind, you know, the philosophy of the school. So you can try lots of different philosophies. I think that is good. We can do that instead of having a more uniform federalized thing for education. But that's because I think education is real flexible. I think if you try to teach your kids and everybody, you somehow get in touch with the people that want to teach kids with kids, then, you know, education can work out pretty naturally. You know, medicine is where things have gone wrong. Okay, something's going wrong, and science matters, and we need to have a system like that. You know, the highway system itself is not so hot, but then again, you look at what the states do with highways. The thing is, there is a need for common infrastructure, okay, for commons. It is important that when I go on the street, I can get to any business based on its distance from me rather than, oh, wait, I don't have a pass for this corridor, or I would have to drive all the way around and spend $5 on gas, making their product seem as cheap. You know, this stuff is not... it's unnecessary complication. The system works much better if you make those decisions, you know, because it's all based on how the free market is alleged to work. You know, the demand has to be able to get to the supply, and so, you know, rites of passage and various things like this, they're fundamental. And health, you know, I would not say it's a right, especially because it's somewhat complicated. I'm not saying 100 years ago we were at the point to do this, but we are now. You know, it's like when you don't have the science to regulate bridge construction, you don't make a bunch of rules about earthquakes. You don't even understand earthquakes and how they work. Okay, but, you know, hundreds of years later, when you get that knowledge, yet you might have to apply it. You know, in older engineering, older things, you start to have some regulations through the knowledge of what's minimal and what'll go, because sometimes you could slap something up that just isn't good enough. And slapping up healthcare, and, you know, requiring businesses to pay for healthcare and become healthcare providers, that's just idiotic. That's just nonsense. Why should every little small business, I'm going to start a business, 35 people, I'm an entrepreneur, I have to become a health care provider for my employees, and unless you're not in that kind of business. But if you're like in my kind of business, you've got to do that. You can't hire those people because you're their health care, and they have to have it. I mean, it's just ridiculous. And that's one thing that's happening when this is happening, is because businesses realize, yeah, we don't actually like to be burdened with that, you know. Okay, you say educated and healthy people make a nation stronger, and I agree, but it's not an argument for state-run education or healthcare. Well, it is an argument for keeping your hands in, and maybe it should be done with regulated. I believe in regulated free markets for things like this. That's why I like the plans where there's private providers. I mean, a lot of people want single payer. I like having multiple payers. I think there should be a public option. But, you know, I think that there should be a competition, and I have no doubt. I have faith in the free market that the competition that's left will be better than the public option, and that's why it'll exist. And the people that are just trying to scrape the market and push people around at the bottom that can't stand up for themselves economically, they will take the public option and drive those people out of business. And eventually we'll have these premium guys figure out how to do it cheap, and it'll be like, oh my God, for almost nothing I can get this other thing. So, you know, or maybe totally nothing. Anyway, who knows how that'll turn out.